Healthcare. It's something we all need. It's not a luxury, it's a necessity. But for many, it feels like a distant dream. Why? Because barriers stand in the way. Barriers like money, location, even language. These barriers make healthcare a privilege, not a right. This ain't right, folks. It's time for a change.
Let's talk about money. Have you seen the price of healthcare lately? It's enough to give you a heart attack. Literally. High medical bills are a nightmare. People are forced to choose between their health and their savings. Some even go bankrupt. Imagine that getting sick makes you poor. That's messed up. We need affordable healthcare solutions, people. No one should have to choose between their health and their financial well-being. It's time to make healthcare accessible to everyone, regardless of their bank account.
Imagine living hours away from the nearest doctor. That's a reality for many in rural areas. Lack of hospitals, clinics, and specialists makes healthcare a logistical nightmare. People have to travel long distances, sometimes in pain, just to get basic medical attention. This is unacceptable. We need better infrastructure, more hospitals, more clinics, more healthcare providers in underserved areas. Everyone deserves access to quality healthcare, no matter where they live. It's time to bridge the gap between urban centres and rural communities.
Healthcare isn't just about doctors and hospitals. It's about communication, understanding, and trust. But what happens when there's a language barrier or cultural differences that create misunderstandings? People feel lost, confused, and even discriminated against. This can have serious consequences for their health and well-being. We need more inclusivity in healthcare. Multilingual staff, translated materials, and culturally sensitive care are crucial. Everyone deserves to feel heard, understood, and respected when seeking medical attention.
Section 5. Insurance Impossible. Navigating the maze of coverage. Insurance. The word alone can send shivers down your spine. The bane of our existence. It's a labyrinth of terms, conditions, and fine print that can leave anyone feeling lost. Navigating the world of health insurance is like trying to solve a Rubik's Cube blindfolded. Each twist and turn seems to lead to more confusion. It's confusing, frustrating, and often leaves you feeling cheated. The endless paperwork and the constant back and forth with insurance companies can be overwhelming. Being underinsured or uninsured is a major barrier to healthcare. It creates a financial strain that many cannot bear. People delay or forego necessary treatment because they can't afford it. This leads to worsening health conditions and higher costs in the long run. This is a recipe for disaster. Missed appointments and untreated illnesses can have serious consequences. We need to simplify the insurance system. It's time for a change that makes sense for everyone. Make it more transparent, more affordable, and more accessible to everyone. Clear information and straightforward processes can make a world of difference. Healthcare shouldn't be a luxury reserved for the privileged few. It should be a basic right, accessible to all, ensuring that everyone gets the care they need without the stress of financial ruin.
Section 6. Mental health matters, breaking down stigma and seeking help. Let's talk about mental health. It's a topic that affects everyone, yet it's often overlooked or misunderstood. It's just as important as physical health, if not more so, because our mental well-being impacts every aspect of our lives. But it's often shrouded in stigma and shame. Many people feel isolated and judged when they struggle with mental health issues. People are afraid to talk about it, afraid to seek help. This fear can prevent them from getting the support they need. This silence can be deadly. Untreated mental health issues can lead to severe consequences, including self-harm and suicide. We need to normalize mental health care. It's crucial to create an environment where seeking help is seen as a strength, not a weakness. Make it okay to not be okay. Encourage open conversations, break down stigma, and let people know they are not alone in their struggles, and improve access to affordable mental health services. Everyone should have the opportunity to receive the care they need without financial barriers. Everyone deserves support and understanding, no matter their background or circumstances, regardless of their mental health status. Together we can create a more compassionate and supportive world for everyone.
Section 7. The transportation test, reaching healthcare when you need it most. Getting to a doctor's appointment shouldn't feel like an Olympic event, yet for many, it often does. But for some, Lack of transportation is a major obstacle. Imagine having to navigate a complex web of bus schedules or waiting endlessly for a ride that may never come. They might not own a car, which adds another layer of difficulty. They may live in areas with limited public transport where buses are few and far between. Or they might have disabilities that make travel difficult, turning a simple trip into a daunting challenge. Missing appointments means delayed treatment, which can lead to worsening health conditions. This can have serious consequences affecting not just the individual but their families and communities as well. We need reliable and affordable transportation solutions to bridge this gap. This could include expanding public transport routes, providing ride-sharing programs, or even community volunteer services. Offering transportation assistance to those in need can make a world of difference. Everyone deserves a way to reach healthcare facilities without breaking the bank or jumping through hoops. It's not just about getting from point A to point B. It's about ensuring that everyone has the opportunity to receive the care they need when they need it most. Section 8. Bridging the Gap. A collective effort for accessible healthcare. Breaking down healthcare barriers is a team effort. It requires awareness, empathy, and action. We need to educate ourselves about the challenges, advocate for change, and support organizations working to bridge the healthcare gap. Let's work together to create a world where everyone, regardless of their income, location, language, or any other barrier, has access to the healthcare they need and deserve. It's time to make healthcare a right, not a privilege. Let's do this.